My name is Kristen Ayuste, and I'm really honored to have a chance to speak with you all. The fact that you're here shows that you genuinely care about making a difference in the lives of families in the NICU, and you're committed to providing the best possible support. I know that what you guys do isn't easy, and it takes a lot of emotional strength, and it's mentally draining. Every day, you guys are dealing with challenging situations and you have to balance the task of enrolling families in your program with maintaining the sensitivity of the situation that the families are in. So, as you know, the NICU can be a very challenging environment for families, and many families experience high levels of stress and anxiety while their newborn is in the NICU. And so it's extremely important to take on a trauma-informed approach to be able to effectively help these families. So in this presentation, I'll provide strategies for you to engage NICU families with the sensitivity and compassion that's needed. So we're ensuring that they feel supported during this critical time while also equipping you as hospital liaisons and staff with the tools necessary to accomplish this. So we'll go to the next slide. And before we dive in, I just want to share a little bit about myself. So I'm a board certified family nurse practitioner with experience in adult and geriatric primary care. But after the birth of my identical twin boys, I got to see firsthand the challenges and the emotional strain that NICU families go through. And that experience really inspired me to help others in similar situations. So I started a nonprofit called Tiny Little Treasures. And now I work with hospitals in the Los Angeles area to provide support, bonding assistance items, and education for families that are currently in the NICU. My goal is to create a community of understanding and care for these families navigating this journey. And I'm really happy to have you guys be a part of it. So today is going to be kind of a combination of me presenting in the webinar information to you and us just having an open, judgment-free discussion throughout the webinar. So I'll be asking questions to kind of guide our discussion. And the goal is for us to learn from each other's experience and to strengthen our sense of confidence when we're interacting with these NICU families. So it doesn't matter if you've worked in this position for 10 years or 2 weeks. In this webinar, there's no right or wrong, and it's okay to be unsure and ask questions. So we have the slide here now that says life in the NICU. So life in the NICU, it's an incredibly challenging environment for families. And one of the biggest challenges is the emotional stress that families go through surrounding their baby's health. And this can come from a lot of different feelings, like worrying about what's going to happen to my baby, or feeling guilty or blaming themselves, like thinking, oh, I should have done something differently during my pregnancy. There's a lot of loneliness in the NICU for families. A lot of people don't know other families who have gone through something like this. And NICUs already have additional visitor restrictions, right? So that makes it even more lonely. There's frustration with the medical process, and there's a feeling of just a loss of control, right? Like now their baby isn't in their care anymore. Another hurdle that families face is being physically separated from their newborn, which can intensify the feelings that they're already having. So parents often have to leave their child for a while, whether it's to go home at night or to rest or take care of the older kids or pets. And that can kind of really add to the feelings of guilt and sadness. And it's a huge disruption to the bonding process. I can tell you the first night that I was discharged from the maternity ward and I had to say goodbye to my boys and go home without them. That was the worst night of my life. I thought I was prepared for it, especially with my medical background and understanding the process of the NICU, but nothing could really get me ready for that. You know that parents can't live in the NICU, but now how am I supposed to live without my kids? So the separation made me feel really sad. And for some reason, I didn't feel like a mother. It also made me feel really guilty when I did go home to rest or to eat. And like I was being a bad or neglectful mom. But we all know how important it is to take care of ourselves. So in this situation, NICU parents really can't win. Even for parents who are able to visit in the NICU so much of their time, the newborn may be too medically fragile to hold. And this is incredibly hard for parents because holding the baby is a vital part of bonding and feeling connected as a family. So instead of enjoying like the warmth and the closeness of holding your child, You might have to settle with just touching or stroking your baby's hand or foot through an incubator. And the lack of physical closeness really leaves parents feeling like they're missing out on important experiences that every new mom or dad gets to have in those first 2 days. So when my boys were born via C-section, they were taken right away to the NICU. I didn't even get to see them, like not even for a second, until over 5 hours later when we were all medically stable. I couldn't get out of the bed yet, so they just wheeled my hospital bed over to the NICU so I could see my babies. And they rolled my bed in between the two incubators, but because the bed was so wide and I had just had surgery and the boys were too fragile to be moved, it was pretty much impossible to touch them with even just a finger. And that was my magical moment of meeting my babies for the first time. Even though I knew they were going to be sent to the NICU, I really never pictured, that being our first way of meeting. Um, so along with the emotional stress, there's medical uncertainties about a baby's condition that can keep families in a constant state of worry. They often have to deal with complicated medical information, tough decisions, and all of that can feel really overwhelming. One of the hardest parts of the NICU journey is that it's not straightforward. There's so many twists and turns along the way. One minute things can seem like your baby is improving, and then the next there can be setbacks that leave a family feeling anxious or on edge. So I'll give you an example. My boys had to be placed on oxygen to support their breathing when they were born, and they were on it for several days. And I would say maybe a week or two later, I walked in one morning and I found that the nasal cannulas were off. And the nurse told me how great they did overnight without the oxygen. And I started to feel this sense of hope, like my kids were going to be okay. And then the next day, I was holding one of my sons in my arms, and the alarm from the oxygen monitor started sounding off. And I turned my head around, and I could see on the screen he was reading in the low 80s, which is pretty low. And I think the nurse could see the panic in my eyes at that moment. So she took him very calmly out of my arms and put him back in the incubator so he could be assessed and placed back on oxygen. Everything turned out to be fine from a medical standpoint, but for me, that alarm became such a major trigger. Anytime anybody's alarm in the NICU would go off, that same panic would set in for me. Even at home, I could get easily triggered by hearing beeping from the microwave or the oven. So that one moment when my baby's oxygen level dropped in the NICU really affected how I felt about my kids being in the hospital. We were no longer on this step one, step two, step three path to getting out of here. We were on this wait and see path. Parents find themselves constantly waiting for updates, feeling hopeful one minute and then crushed the next. And this unpredictability can lead to really high levels of anxiety and even PTSD as they try to navigate the intense ups and downs of their baby's health. Being in the NICU, it can be really tough to find a sense of stability. Lastly, financial worries can really weigh on families since the cost of long NICU stays, medical care, possibly loss of income for the parents, all of that can ramp up their stress. And that's often on people's minds, but it can also hit them unexpectedly after they leave the hospital when the insurance processes everything, and families get the big medical bill. A lot of our families that we're taking care of, right? They're already low income and they're facing financial struggles. So this makes it even tougher. The other thing you have to consider is many families may have previous traumas like physical abuse or housing insecurities. And so these traumas can be re-triggered in high stress environments like the NICU stay. So we've talked about the emotional stress, separation from the baby, medical uncertainties, financial concerns. I'd really love to hear if anybody remembers working with a NICU family where you saw some of these challenges, and what it was like for you. And just go ahead and I don't know if you guys have the ability to just unmute yourself if you want to share. And I'm also curious, let me see if I can change the view. By a show of hands, how many people have already had some experience working in the NICU with families? So a couple, and then a couple are newer. Okay. So that's why we're doing this webinar, right? Is to help help you kind of like feel more prepared to help these families because it can be very overwhelming in the NICU for families and for staff. Um, we'll go on to the next slide and talk about trauma-informed care. As I said before, your work is really challenging to begin with, right? You're a stranger to these families and you're popping into their room shortly after they've given birth, and you're trying to talk to them about something. We're going to talk about the concept of trauma-informed care and how, as hospital liaisons, we can use this information to better interact with our families. Um, by a show of hands, how many people have heard the term trauma-informed care before you signed up for this webinar? Okay, so a couple. Um, so this term was actually something that I hadn't heard of until like maybe a year ago. But the concept itself has been around for a really long time. The need for trauma-informed care uh, it really began with the return of the Vietnam vets, which heightened the awareness in the medical community of post-traumatic stress disorder. So, right, we had all these like incredible men who went and fought for our country, and then they come back with these invisible wounds from war that not only affected their lives, but it also impacted their families' lives and their communities. And the realization of this sparked the broader understanding of trauma and its impact. So it led to the recognition that many individuals, not just veterans, require compassionate, informed support to heal and to thrive. So now, over 30 years later, it's evolved to include anyone who's experienced a trauma. We have these evidence-based models now for trauma treatment emerging, which is leading to changes in organizational policies and practices. And it's meant to promote resilience and recovery within the child family serving systems, which is what we're here for, right? But before we can provide the services that we have to offer to these families, it's really important to understand the concept of trauma-informed care and how it can be implemented in the NICU setting. We've discussed previously trauma-informed care is a vital framework and it acknowledges the profound impact that trauma can have on individuals and families, particularly in high stress environments like the NICU. According to the Substance Abuse and Mental Health Services Administration, trauma-informed care is defined as a strengths-based framework that's grounded in the understanding of and responsiveness to the impact of trauma. So this approach is based on a few key ideas that shape how we interact with these families and support them. And in the next slide, we're going to go deeper into each of these key principles and how to connect them with the trauma experience. And I know you guys are a quiet group, and that's okay. But I would love to get a discussion going. And I just wanted to hear, for those of you who have had experience in the NICU, um, what are your thoughts on how understanding trauma um, can change the way that we care for families? Or what has your experience been in dealing with families in the NICU who are experiencing traumas?
Um, my name is Fatima. For the first question,
Sure.
I think it makes an impact on how I carry myself in the room, with my tone of voice,
Yes.
maybe like slowing down a little bit more,
Yes.
working on getting the mom's eye contact because sometimes they're so used to the nurses um, going in and out and doing everything so fast that when somebody actually stops and takes the time and gives eye contact, it's like they're not used to it. So just taking my time. So that was my experience.
Yeah, that's great. Does anybody else have any other experience they want to share? Okay, so thank you, Fatima, for sharing. That's exactly how we can approach these families. I think that you're doing that really out of like compassion and empathy. And we all have that in ourselves because we're doing this work to begin with. But trying to accomplish a task-based service while balancing a sensitive situation is really hard and it can be really overwhelming. So that's why we're going to go through these steps and try to give you guys like some more tools in your tool belt to be able to get your job done, feel good about it, and be able to reach more of these families like in a more effective way. Um, let's go through each of these key principles and talk about how they can apply to the NICU setting. So the first principle is safety, which means making sure that families feel both physically and emotionally secure. Um, Physical safety is all about making sure families feel like their babies are in good hands with well-trained staff. This reassurance mainly comes from the caregivers, but we as hospital liaisons can reinforce that through our words, and that can provide a lot of comfort to families during stressful times. So just by showing that the staff is skilled and qualified to take care of their baby, we can ease some of the family's worries. So I'll give you an example. I'm a medical professional, and I don't know why, but we are always the worst patients, right? We tend to be very hesitant when we're under someone else's care. And really, I think it's like more about a lack of control. But now I know nothing about the NICU beyond what I learned in my pediatric rotation, like over, 10, 15 years ago. But here I am, like already questioning whether my babies are safe and if the staff knows what they're doing. I remember somebody saying to me, and I can't even remember who it was, but they said, "Oh, you have Victoria as your nurse today. She's amazing." And just like that, the sense of unease started to dissipate for me. And I began to trust, like, my babies are safe here. I was also able to spend more time and more of my mental energy on other things instead of worrying about the quality of care we were receiving. And mind you, I was at like a very big name, well-known level 4 NICU. So there's never really a sense that I was somewhere with untrained staff or incompetent staff. It was just an irrational fear that was created by the stress of being in the NICU. So, by acknowledging families' fears with a statement like, you and your baby are in capable hands, that's showing empathy, right? It lets families know that we understand the emotional toll of being in the NICU and genuinely care about their well being. This approach builds trust and it encourages open communication between families and staff. So when families feel like they're being heard and understood, they're more likely to take an active role in the baby's care, which can improve their overall experience in the NICU. So I would say I spent about a good week just watching my boys being cared for by the nurses. And it was mostly because I was afraid I'd do something wrong and because I already didn't feel like a real mom. When I finally started feeling comfortable enough to tell this staff that, they were really encouraging and they helped me find ways to get involved in routine care, like taking temperatures or changing diapers. And those little moments helped me connect more with my babies. And with each step, I began to feel more like their mom and less like an outsider looking in. So the verbal reassurance we provide really helps build a supportive relationship between us as staff and the families. And when we keep delivering this message over and over again, it creates a lasting sense of comfort and confidence that families can tackle the challenges that the NICU has in store for them with more resilience. This kind of supportive language not only reassures families, but also empowers them to use their voice to bring up concerns and to get involved in their child's care. The physical and emotional safety concepts kind of go hand in hand. So, the emotional safety involves creating a more supportive environment where families feel comfortable expressing their fears, concerns, and questions without judgment or dismissal. And so, when we initiate this more compassionate communication, active listening, acknowledging their experiences, we can ensure that families feel valued and understood. So next we're going to talk about trustworthiness and transparency. So when families know they can count on the information that they're getting, it eases some of their anxiety and uncertainty. So being open and honest helps build trust by keeping families in the loop. As hospital liaisons, we're really limited with our time with the families, and I understand that. But if we can build good relationships with the NICU staff, we'll be able to have conversations with, for example, the nurses who can fill us in on that particular family situation, and that will better equip us to address that specific family's needs. When we talk with families, we should encourage questions and provide clear explanation without the medical jargon so that they really understand the light touch program that you guys are offering. It also is important to admit when we don't have all the answers, but to promise to follow up with more information if you can as it comes. And again, this just comes back to having a good relationship with the NICU staff, being able to advocate for a family and get someone to help when they need help that's out of your scope of practice. We can say, you know what? I don't know, but let me ask your nurse to stop by. And then when the nurse stops by, I can tell you as a parent of a child in the NICU, the second thing that will come to that family's mind is my nurse came when I needed her. But the first thing that's going to come to their mind is that hospital liaison did what she said she was going to do, and I can rely on her or him and that information that they're providing me. So it's all about like building that trust. When families feel included in the conversation and are treated like partners in the care, it boosts their confidence in the healthcare system and it lays the groundwork for a strong foundation between families and caregivers. And this trust not only supports families during tough time, but it also empowers them to advocate, like we said, for their child's needs and to actively participate in their care journey because it doesn't end at the NICU. It's a long journey after that. The third principle is collaboration and mutuality, which emphasizes how important it is for us to work together with families as partners in caring for their newborn. So, families have valuable insight and experience that are crucial for their babies' well being in the NICU. For example, understanding family structure and dynamics can help the staff support siblings or other family members who might be feeling anxious or left out. Um, I'll give you another example. 3 days after my boys were born, my stepdaughter had a medical emergency at school, and she was brought into the same hospital that we were in. I told the nurse that so that I could, excuse myself from the NICU to get wheeled down to the ER. And later that day, when I was back in the NICU, where I was, we just had like curtains to separate the rooms. It wasn't really a room, it was like open with a bunch of different incubators. So I had my curtain closed. And I overheard the nurse relay that information to somebody who turned out to be a lactation consultant that was about to enter my area and come work with me. Now, why is that important? Because it lets another staff member know I was experiencing another trauma, and it allowed that lactation consultant to be extra sensitive and understanding if I were to seem hesitant to talk about breastfeeding. Obviously, I was constantly thinking about the health of my newborns. But what was really at the forefront of my mind that day was whether or not my stepdaughter had a traumatic brain injury. She was discharged later that evening with a concussion after being cleared by her medical team, but it took me a while to move past what had happened. This experience highlights the importance of staff being aware of family dynamics and potential traumas that each family member might be facing. Um, so before we move on, and I know you guys are such a quiet group, um, for people who have worked in the NICU before, we have a lot of staff in here who are either new to their position or haven't had experience in the NICU. Does anybody have some advice on how to start creating those relationships with the NICU, or like how did you get to a point where the NICU nurses knew your name or the social workers knew your name? Like what steps did you take to do that, or any advice you have for your colleagues? You guys are so quiet. Okay, so
I'll share. I'll share.
yes, thank you.
So for advice to create a relationship with the client, um, I go in and I say, "Hi, my name is Fatima," and I introduce myself, and the open palm thing helps people to see that you're not a threat. That kind of helps. And I still say congratulations on the birth of your baby, and I think, and with a smile on my face, and so they know I'm not here to give them bad news or anything like that. So that helps with the patients or the clients, and then relationship with the social workers. We see each other kind of crossing paths in the hallway. So I'll say, "Hi, how are you? How's your day?" Something very brief, and so they know myself and Maria Guerrero, the HLD, the ones that work here at Queen of the Valley. So yeah, and then for information about babies in the NICU, I don't necessarily go to the NICU to get the information. We're able to see the chart, so we gather some of the important stuff, of course, from the mom to get her perspective, but some of the stuff from the chart as well.
Yeah, that's great. I've never heard of the open palm. That's something that I will probably end up using when I go back into primary care practice. I really love that idea of like showing, open palm, you're not a threat. And I can really appreciate trying to come across as someone who's not about to walk in with bad news. When I was in the hospital, it felt like every 30 minutes someone was coming in to tell me something else that was wrong with my body after giving birth. Or, when you're in the NICU, most hospitals, you have the maternity ward, and then down the hall is the NICU. So, when someone walks in, I don't know if they're there to talk to me about my preeclampsia and how it's getting worse? Or are they here to tell me like, oh, we're coding your baby. We just want to let you know? Those are all fears that like really sit in your head all the time as a NICU mom. So I really appreciate the open palm, the wanting to express that you're there to give them some good news. And I love that you say congratulations because I don't think anybody said that to me. And if they did, I don't remember. So the more you say it, I think the more wonderful that is. I would encourage you guys, if you can, to try to develop relationships with your NICU staff because they're going to have a lot of information about the families. And as you know, the world is becoming more and more about charting, charting when someone goes to the bathroom, charting when you've turned somebody, the little things, but sometimes like the bigger things and the more important things get missed. So it wouldn't necessarily be in my chart, right, that my daughter just had a medical emergency. So check in with your nurses and just tell them like, hey, my name is Kristen. I just wanted to let you know that I'm here representing this company. And I'm just gonna talk with the family about some of the services we offer. And that nurse might say, oh, you know what, that mom, she's super depressed. So like maybe if you can encourage her, let her know like you guys will offer check-ins after, or she doesn't have support at home, she doesn't have family at home. It kind of clues you guys in on how to connect the services that you guys have to offer with the situation that's going on with the family, because not everybody is going to need the same services. And your job as liaisons, right, is this light touch program. But knowing um, I had to ask Catherine and Faith a couple of times. I'm like, what is a light touch program? Because I never had that. So knowing, being able to say like, we do this light touch program, someone's going to follow up with you, and we will also, potentially offer other services like support groups, like lactation services, or whatever else you guys have to offer. Tailor that conversation to maybe what you know is going on with that family, because that will clue them into, what, this is a program that I think I do want to follow up with, right? So thank you so much for sharing that. I really appreciate it. The next concept on this was empowerment. So we'll stay on this slide. Are you
Sorry to
good?
interrupt you. I don't know if you can see, there's also a hand raised. I just wanted to make
Oh,
sure.
no, I can't see the hand.
Okay, okay,
So
great.
many
I know you
people.
were trying to encourage it, so I just wanted you to know.
Yeah, yeah.
Elaine had her
Whoever's
hand
raising
up.
their hand, I'm sorry. There's so many of you and the slide, I can't
Yeah, no,
see.
no, great.
So.
It's
Elaine.
okay, no worries. Thank you. Thank you, Faith. Kristen, thank you so much for sharing your story. I mean, I appreciate that. It was probably such a, like you said, very traumatic, so stressful and just overwhelming, just all of the unknowns. And
Yeah,
like you said, every time someone came into that room, like, what are they going to say? Is it about me and my baby? So thank you so much for opening up and sharing that with us.
yeah.
It's nice to hear that because we're also hearing that from like someone else's perspective from being on that end, like afterwards. We only see them there for a little bit and then they leave and then we don't know what happens to them. So hearing the aftermath of everything you went through, it just like it's really nice to hear. It's an eye opener for me as well,
Yeah,
So thank you.
yeah, thank you for that feedback.
Of course.
It's I feel like I went to a good school. I learned a lot. I read, I studied. But it really
Mhm.
wasn't until you like get into the real world that you see like life is not the textbook.
Right.
And I always thought I was a good provider, but when I started experiencing different traumas, it made me become more sensitive to my patients' situations, being a little bit more open-minded. So yeah, that's why I'm here today is to talk to you from both sides of it because it's it's a trauma that can stay with you for a long time. And a lot of people have different reactions to trauma that we'll talk about. And so you don't know if your client is just a really nasty person or, is like
In the
reacting
moment.
to a stressful situation. So
Yeah.
um, all the things that we're going to talk about today, they're really just meant for you guys to keep in your tool belt, to help you do your job and to feel good about it too, right? Like nobody wants to walk away feeling like, that family didn't want to talk to me or
Right.
whatever.
Right.
You guys are doing an incredible job. And I told Catherine and Faith, like, I wished so badly that I had something like your Light Touch program. That would have really changed the trajectory of how I dealt with things postpartum. I also had the kicker of having babies, and then like 6 months later, we hit the pandemic. So,
Wow.
all of that together,
Wow.
it's a lot. And so I just really want to say to you guys again, thank you for doing what you do. Um,
That's awesome.
I wish I could go back in time and then call Faith and Catherine. Hey, I'm at this hospital. Can you come do a light touch on me?
Right. Yeah,
So
of
thank you.
course.
Thank you for sharing.
Of course, no,
Um,
thank you.
yeah.
I can I just mention also, Kristen, if that's okay. You were mentioning like how do we build that relationship and that connection with the NICU staff.
Yeah.
So we're an outside entity. We're contracted with the hospital, so
Right.
we are kind of like staff, but we're not.
Yeah.
What we do is we just really try to like put our names out there. We greet everyone as well. And then we also do presentations for both triage and labor and delivery staff. We do the morning huddles and we do like weekly them flyers and sometimes we even make them like a little like a goodie basket just to say, hey, thank you for your communication, your partnership,
Yeah.
your support in reaching our, families. And then so we do those presentations in the morning, like every shift during the
Yeah.
shift. So that they're more aware of who we are, like why are we walking around there,
Yes.
so and it's interesting to see that sometimes even though like they know who we are or we've done the presentation, they'll still ask again,
Yeah.
so and that's okay, so yeah, that's one of the things that we do. Jody's one of our she's our IBCLC. She's stepping in right now. We were a short staff, so she's amazing. She's helping me out at the hospital. So it's oh my gosh, lots of love to Jody. But yeah, she's one of the nurses also that goes to the families' homes, and then they do get those 2 visits. So she's able to go into the NICU and support the families during that visit. I personally I like to save that time for the patient so that she can be there with her mom, but with her baby.
Yeah.
But I'm very happy to provide support and just acknowledge, meet where she's at in the room. I mean, I talk to them about the felt heart that they have. We have that at our hospital where
Yeah.
they can exchange. Yeah. So all of that. And then if the mom wants to cry, whatever she's going through, all of that stress, just being there for her in that moment, and just putting my stuff down and just really like being, into that conversation in that moment with her. So it's good.
Yeah.
And one of the things that I in our last webinar, one of the things that they shared with us, she said something about, I know you weren't expecting your baby to come so soon. So this is all like new for you. This is not what you planned.
Yeah.
So it's okay to feel what you're feeling. It's normal. So that really just really got hit me, and that stuck with me. And I've been using that type of verbiage, and it's really helpful because they feel like, okay, this is normal. I'm not the only one going through this. So yeah, thank you for letting me share. I'll stop.
No, it's okay. It's great. I think, what you're doing is you're validating their feelings, and that is what you need. Like, I tend to be a very stoic person, and I keep everything in. Um, and it isn't until someone says to me, um, sorry, my dog is barking in the background. Sorry if you can hear that. But it's not until someone says to me, like, you didn't expect this. And it's okay to be upset. It's okay to be angry. It's okay to be scared. Um, Validating that feeling kind of like lets down the wall and starts that communication, which is what we need. Um, so we were talking about kind of the concepts of or the framework rather of trauma-informed care. So the next portion of that framework is empowerment. And that's another important principle in the framework because it gives families a sense of control over their experiences and their choices, which doesn't happen a lot in the NICU. For instance, when families are encouraged to ask questions about their baby's care or treatment options, it makes them feel like they're more involved in the process, and it leads to better outcomes and satisfaction. So in this way, families feel more supported and informed, and they feel like they're being allowed to take an active role in the decisions of their baby's care. And we don't always feel that way in the NICU. A lot of times we feel like things are being done for us. Um, so finally, the framework addresses how important cultural, historical, and gender issues are, making sure that care respects and responds to different backgrounds. This means recognizing that each family's experience is influenced by their own cultural background, their history, their gender dynamics, and family structure, and including diverse families like same-sex parents. So an example of family's cultural belief might be that how they view medical treatment or who gets to be involved in the decision making or how they communicate. So just being aware of that and including these factors in the care, we can create a more welcoming environment that really honors each family's identity and their experiences, regardless of their unique composition. Um, Plus, this culturally aware approach, it helps reduce biases and understandings that can get in the way of good communication and trust between families and staff. So when we make an effort to understand and respect the different backgrounds, we can better meet the needs that are specific to their family. And it makes them feel valued and heard. So when it comes to like gender issues, the trauma-informed care in the NICU, there might be different expectations for how mothers and fathers are supposed to act during caregiving tasks. So moms may feel a lot of pressure to be the main caregiver, and they might struggle with feelings of not measuring up, especially if they're recovering from childbirth or dealing with health issues. And dads, on the other hand, they can feel sometimes kind of overlooked or less involved in their child's care. Um, because sometimes the focus becomes mainly on the maternal role. And same-sex couples and single parents, they face their own unique challenges and societal expectations of how they can be involved in caregiving. So just recognizing these dynamics is essential because it helps us create a more welcoming space where all parents, regardless of their family structure, can play an active role in caring for their child. And by encouraging all parents to take part in caregiving tasks, um, and asking, for their thoughts and validating their experiences, like you just said, we can really ease some of the feelings of either inadequacy or exclusion. And this leads to a more collaborative, more supportive experience for all the families in the NICU. Um, when it comes to historical issues, we see the impact of systemic inequality and discrimination that some communities still face in healthcare. For instance, families from marginalized backgrounds, they may carry the weight of past traumas from things like non-consensual medical practices or lack of access to quality care. And understandably so, this can create a lot of mistrust in the healthcare system, and it can make them more hesitant to be fully engaged with us as staff. A family that's experienced discrimination in the past may approach their child's care with skepticism, or they might be worried that their concerns are not going to be taken seriously, or that they're not going to get fair treatment. So just by kind of acknowledging that, we can approach these families with a bit of a greater understanding. Um, so I know this is kind of a hard question, but I just wanted to get some ideas and share some thoughts. Um, how would you guys do that without saying like, hi, you come from a marginalized community? How would you validate a family who might be experiencing that? It's a hard one, right?
If you speak their language, then you can speak their language. I think that helps a lot.
Yes.
Um, that's it. That's all I got.
No, that's great. I mean, I think a lot of a lot of families, right, that we take care of, they don't speak English
Or
or
sorry to interrupt, or
yeah,
I use voice interpretation system, so we do use that. But
yes.
it helps, of course, for me if they speak Spanish, because then I don't have to use it. But if any other language, and
Yes.
we use the voice interpretation.
Yeah, that's perfect. So if you have that language that the family speaks, use it. And if you walk in the room and you say hello and they respond hello to you in English, um, you can ask them, is English okay? Or do you prefer Spanish? Or what language do you speak? Because they might know English, but if it's not their primary language, um, when you're under stress, like your brain doesn't work. So it can be even more challenging to like really listen to what you have to say when you already have a language barrier. So trying to use their language, if you can't speak their language, either finding somebody who's a qualified staff that can interpret for you, or like you said, using the interpretive services is great too. Just by actively working to build trust and showing a commitment for fair care, it really helps ease some of the fears that are tied to these past traumas that families experience. And we can offer resources that the program's committed to equitable care, like advocacy services that you guys offer. And that further builds the trust and fosters a more positive relationship with your families. So, just by actively seeking to understand and respect diverse backgrounds, we can address specific needs and concerns of each of the families that are so that they can feel valued and heard. So we're going to go on to the next slide.
Kristen, I'm sorry I keep interrupting.
No, it's okay.
There was also another hand
Okay,
earlier.
great. Let me hear it.
From Jody,
Yeah.
who had a comment earlier, I believe.
I've worked a lot with NICU moms, especially doing lactation and really meeting them where they're at, seeing if they want to pump, helping them with pump schedules, giving them something they can control. I talk a lot about, you walk into the NICU and like I didn't have a NICU baby, but my own baby had bad jaundice. And it was basically, I was told, she's my baby now, you have her for the next 18 years. And it just, for me, that
Yeah.
puts me directly in a NICU mom's shoes because it is still your baby. And it is so heartbreaking for the mom leaving that baby and coming in and all those bells, like you had said. And a lot of times, because the nurses have more than one baby that they're caring for, they can have two heart monitors on a screen. And I've had moms get really upset thinking that the baby whose alarm was going off was hers. And it was the baby that the nurse was taking care of, on the other side of the curtain or whatever. And so even being mindful of that and explaining the different strips and that it's not, this is your baby and this is the other baby in the next curtain or whatever. And just really talking to them. And I used to work a lot with Jessica, and so who did Mighty Little Giants, and she's down in San Diego. And she even talks about the importance of going for a walk and taking a break.
Yes.
And at the WIP where we work up in the AV, it's really nice. You can walk around the perimeter, and I've seen moms walking, so that's really cool, and going out and getting fresh air. And then another story I have, I'm meeting them where they're at. I had, as an RN home visitor, I had gone in to a home, and the mom was giving the dad a really hard time that he didn't know what he was doing and changing diapers. Baby had just come home. It was my post NICU visit. And we found out in that visit that dad had been sneaking out in the middle of the night while mom was sleeping to go spend time with baby in the NICU. And he had learned how to change baby's diaper, how to feed baby, how to help mom with breastfeeding and things like that. And she didn't know he was doing any of that.
Yeah. Yeah.
And so even including dads
Yes.
is so important.
Yes.
So that's,
Yeah. Thank you so much.
You're welcome.
I think what you just said is beautiful. 100% meeting them where they're at. It's hard for me to understand your role because as a medical professional, I never experienced anybody who offers what you guys offer. I mean, I've worked with social workers, but it's kind of different. You guys have a very specific program. So sometimes it's hard for me to be able to apply these concepts to your role. So I really appreciate the input that you guys offer because it gives me a little bit better understanding of my audience. But you guys are also giving really great advice to your colleagues. Um, so thank you for what you guys do. Let's see. So yes, okay. So now we're going to go on to common trauma triggers. So before we can effectively interact with our families, we need to understand some of the common trauma events the NICU families experience. Being able to identify these as traumas helps us communicate more with more intentional compassion, like we had said before. So the first is a premature birth, which is anything before 37 weeks. The uncertainty of an early delivery and immediate health issues that a preterm baby might face can create a lot of fear and helplessness for families. And as parents of a NICU baby, we worry about a lot of things. Like, is my kid gonna live? Are they gonna have health problems later? Is it because of something I did during my pregnancy? And there's a lot of parents that are still trying to get things ready for the nursery, right? Like, you're supposed to still have 3 more weeks to get ready, and now here's your baby, surprise. Um, a lot of NICU families have their babies that are now dealing with medical issues like trouble breathing or infections or birth defects. And that can be really overwhelming, especially when there's a lot of medical terminology or treatment plans being thrown around. Um, Knowing that their baby has to go through a painful procedure can leave parents feeling really traumatized. And remember, some parents are expecting a preterm birth because of complications in their pregnancy that was seen on an ultrasound, but a lot of parents were not. They were expecting a full-term baby and instead had an experience like a difficult birth or something unexpectedly was discovered after birth that leads to complications in NICU stay. So just the fact that somebody is, um, in the NICU, that should be like sign number one that this family has experienced a trauma. The next common traumatic event is the separation of the infant. And like Jody had said, so this can happen in two ways. So the first is when the parents can't hold or care for their baby right after birth. And that makes bonding and attachment so much harder. The second way is having to be away from their little ones to either go home for the night or take care of other responsibilities or go for a walk. Not being able to provide care for your new baby can lead to feelings of guilt and powerlessness. And that leads us into the last one, which is the loss of control. So families feel a huge loss of control during their time in the NICU. Not being able to influence their child's care and the outcomes can make anxiety and trauma even worse. I think as a NICU mom, one of the hardest things about having a baby in the NICU, for whatever the reason is, whether it's like a simple need for supplemental oxygen or something more involved, like a congenital anomaly or a need for surgery or procedure, The NICU is not a straight trajectory to the finish line, right? So we talked about it before. The NICU is full of ups and downs, and so re-triggering is common. And unfortunately, there's a lot of opportunities to be re-traumatized in the NICU. So we're going to go to the next slide. Okay, so signs of trauma. So we've discussed common trauma triggers, but what are some signs that a family might be going through a trauma? Well, first hint, right, is they're in the NICU. So there's sign number one. But there's also things like anxiety and depression, difficulty bonding with baby, anger and irritability, avoidance behaviors. So we're going to go through each of these and talk a little bit about what you might see in a family that's experiencing that so that you can kind of be more mindful about what the situation might be for this family. So first, anxiety and depression. A lot of families go through high levels of anxiety and depression while their baby is in the hospital. They might be constantly worrying about the baby's health. They can be having panic attacks or just feeling really sad. The mental health issues can stick around, like I said, even after they leave the NICU, making follow-up care for you guys really challenging. So how do you know someone is experiencing anxiety or depression if they don't tell you? Well, you might notice signs like they have a lack of interest in their baby's care. They're having trouble engaging in conversations with you, or they're expressing feelings of hopelessness and just the loss. When we see people having difficulty bonding with the baby, as we said over and over again, trauma can make it really hard to bond with a baby. And the stress can take up a lot of their mental energy, and that leaves little room for information, for new information or for active listening. So you might see parents struggling to do nurturing things like holding or feeding or talking to their baby, like things we would normally expect to see with new moms or new dads. Um, Babies in the NICUs also have a lot of wires and monitors attached to them, and that can make picking them up feel like a really daunting task when it should be something so simple. So the fear of doing something wrong can really overshadow the joy of that moment that they should be spending with their baby. We mentioned this previously, but traumas can lead to increased frustration and irritability. So you might notice this um, in families if you see somebody having short tempers or outbursts towards staff or having a hard time managing their emotions in stressful situations. And I think this is it's really hard on the parents because they can come across, like I said, as like really nasty or ungrateful, but in reality, they're just really frightened and they have no control over the situation or, what's going to happen with their baby. So just being sensitive to somebody who reacts that way will help us reach these families a little bit better. Um, for avoidance behaviors, families can show avoiding behaviors in in ways that they're trying to cope with their trauma. So this can mean like staying away from the NICU or not wanting to talk about their baby or what they've been through or pulling away emotionally from their baby. So these behaviors can all make bonding harder than it already is in the NICU. It can slow down emotional recovery for parents and it can make it tough for families to get involved in the services. So you might see signs like they're refusing to hold their baby, or they're not wanting to participate in feeding, or they're avoiding skin-to-skin contact. We can also see sort of the opposite, so hypervigilance. Parents can become very hypervigilant, like always on edge with every sound or movement that happens. A constant state of alertness can be so tiring and it can make it really hard to relax or find peace. So hypervigilance can also mean being more aware of the medical environment. Parents can be more sensitive to changes in staff behaviors and equipment sounds. And so this can include signs like constantly checking the medical equipment or showing excessive concern about changes in their baby's condition or reacting strongly to small disturbances. So I really like what Fatima said about like walking in with a palm up and saying hello because that can kind of bring a family like a sense of peace, kind of breaks up that hypervigilant or the hyper alertness that they have so that they can listen to what you're having to say. And so this is always a fun one, difficulty concentrating. And any tired mom can tell you it is very difficult to concentrate when you're tired or overwhelmed or you have a lot on your plate. So as you can imagine, trauma makes it hard for parents to focus on and process information. They're tired, they're overwhelmed, they're frustrated, their brain is at full capacity. And it's challenging because your job is to provide them with more information, right? So when this is happening, you might see them asking the same question over and over, or struggling to remember what someone told them, or having trouble following care instructions. So it's not because they don't care or they're choosing not to listen, it's because they're really, really overwhelmed. So I'll give you an example. I'm a nurse. I spent an entire half a year in school in a class focused on pediatric care, including care of newborns. So, but now I'm a new mom. I'm stressed out. I'm exhausted. People keep coming in and out of my room to take my vitals or give me medication or have me sign a form. Um, and I can't tell you the number of times my baby's nurse had to show me how to change their diaper. Each time I tried, I'd get more nervous and I'd tell them, I can't do it. I can't do it. And I would just ask them to do it. And I couldn't pay attention well enough to like follow these very simple steps. So something as simple as changing a diaper, um, it's very hard to do when you're experiencing trauma. So not only was I having a hard time concentrating, but I was avoiding care and I was angry at myself for not being like competent enough to do this. Um, so we have to give ourselves and our families a little bit of grace. So we are, let's see, going to go to the next slide, and it's going to be a continuation of the signs of trauma. Um, so there's some communication signs of trauma that we can see when we're interacting with parents. So again, seeking constant reassurance. Parents often feel like a lot of validation, or they need, sorry, a lot of validation for the feelings and their decisions. So you might see them repeatedly asking you guys or asking the staff, like, am I doing this right? Or expressing doubt in their ability to take care of their baby. So um, this is funny now, but uh, when I was in the NICU, I can remember, so my boys got discharged a week apart. So I had one boy home with me, one still in the NICU. And I called the nurse at 3 in the morning because he hadn't pooped in 8 hours. And so that is totally normal, but that was me seeking reassurance that I was taking care of my child properly, even though he was just sleeping. So you may see some of that with your families. Expressing guilt or shame. Many families feel guilty or ashamed about the situation, or they think they should have been able to do something to protect their child. And you can see this if they're making like self-blame statements like, oh, I should have done this differently, or just avoiding conversations about their baby's health. Um, Lastly, there can be physical signs of trauma, and those are going to be much harder for us to pinpoint and say, oh, that's trauma related. But we know stress can do a lot to our bodies. So sometimes that can manifest as um, families complaining about headaches or stomach aches or fatigue, something that doesn't really have like a clear medical cause. Um, so I'm just curious, have you guys seen any of this in your NICU families at all um, or experienced this? Yeah. Yeah. There's so many things that a NICU family is going through, and there's lots of different ways that people respond to trauma. So we're going to talk about that next, actually. So let's go to the next slide. Okay, so responding to trauma. Recognizing signs of trauma is really the first step in offering trauma-informed care, especially in the NICU. So we can respond to families that are experiencing trauma first, by creating the supportive environment where families feel comfortable. We've talked about this so much already, but how important it is for families to feel physically and emotionally safe and in a judgment-free environment because they're likely to have a lot of questions and they're afraid to ask or even think because of the enormous amount of stress that they're under. So approaching them with empathy and understanding. And it's so important to validate how parents are feeling because I feel like um, that's the first step in connecting with your family is just by validating them. They say like, okay, this person is listening to me, or this person understands me or understands my situation. And that's like really the first step in building that relationship. You guys are limited on time that you have with your families. And the sooner that you can make that connection, the more likely they are to have a sense of active listening and want to hear about what you guys have to offer. And then, when they get discharged, like have that follow-up care that they really do need. Next is going to be making sure that everything is clear and straightforward. So building the trust and collaboration with the families, using plain language instead of medical jargon, even if they have a medical background. Don't do it. These families are exhausted, and I don't know about you guys, but like my brain does not work at all when I'm tired. I tell my family all the time that my brain shuts off at 7 p.m., so don't ask any new information from me. Um, so they know 7 o'clock hits, no more asking Kristen questions. Um, Emotional support is honestly probably the most important thing that NICU families need. So just making sure to offer information about services that you guys have to offer, like counseling or support groups, to help families cope with their experience. Because I can tell you that even if you have a very smooth NICU stay, which almost never happens, just the fact that your kid went to the NICU is a trauma in and of itself. So just letting them know that you guys, your program offers these other services, whether they verbalize it or not, everybody's going to need it. And it's just so helpful and so wonderful that you guys have these programs to follow up with these families. We also just want to be mindful again of like the cultural differences. So it's really important to recognize how the differences can affect how someone reacts to trauma. So, for example, families in cultures like Latin America, where emotional expression is more encouraged, these families might feel more comfortable opening up and talking about their feelings regarding their child's stay in the NICU. They might be more willing to share their worries or emotions more freely. But on the other hand, families from cultures that value more stoicism, like a lot of Asian cultures will value that, they might be keeping their feelings more to themselves. And that can sometimes lead to misunderstanding about how they're really feeling about you and about their child being in the NICU. So just being aware that there are differences, we can communicate a little bit better and support our families in ways that feel right for them. So to better understand and support our families in more stoic cultures in with our communication, it's really essential just to, again, create that safe, welcoming environment where they feel comfortable expressing themselves when they're ready. Patience is key. And I know, again, like you guys don't have a lot of time to spend with these families, but anybody else who's in this program or ends up doing follow-up care, let's say you've worked as a hospital liaison for 10 years and you're ready to transition into a new role where you do the follow-up visits. Just remind yourself to just be patient with these families because this is a process for them as well. And some families, it just might take them longer to get through their feelings. So giving them the space to do that is so important without putting pressure on them. Using open-ended questions that can really encourage families to share more and to feel like they can choose. So you can ask them like, can you share how you're feeling about your child's care? And just observing like the nonverbal cues and the body language and facial expressions that can provide some insight into the emotional state as you communicate with them through these kind of body language rather than words. Also, just being mindful about your own body language. So when you speak to these families, um, if you're on the maternity ward, right, the moms are almost always in the bed or sitting down. They're never really just standing up and having a conversation with you. And you're walking in the room. So try to find a chair, position yourself where you guys can be at eye level. It kind of takes away that position of power or the family's sense that like this person is in charge of me and I'm not in charge of myself. So making it more about being a team and collaborating together, using like a softer voice, again, like the palm being open. So just being aware of your own body language. Um, And providing written information. It can be so beneficial if you guys have pamphlets or anything that you can leave with families so that they can process this information and the details on their own pace. Encouraging gradual sharing by starting with general topics about their child's care can help build trust before delving into deeper emotional discussions. Offering support resources that you guys do, like counseling, um, and framing it that it's available for all families, that can normalize seeking help without singling anybody out, which is so important. And it's really crucial to respect their communication style. So acknowledging that they may prefer to be more reserved and not pushing them to share more than they're comfortable with. So adopting these kinds of strategies, it can help us create a more supportive environment and just respect the communication preferences that people have from these more stoic cultures. Um, Spotting signs of trauma in the NICU families is so vital to providing the right support and care. So just by acknowledging the emotional, behavioral, communication, and physical cues, we can respond more effectively to their needs. So implementing this trauma-informed practice not only improves the care experience for parents, but it also supports the overall well-being of the infant in the NICU because now their parent is becoming more involved in their care, and that can promote better bonding, better overall health of the baby. So remember, addressing trauma sensitively really helps families feel heard and empowered to take part in their child's care. So we're going to go to the next slide, and we're going to talk about, oh, let me see. I think we just went through this. No, go back. Sorry. Um, let's see. And go back one more. I'm sorry. Okay, sorry. Okay, go back to the one you were just at. Yes, effective communication strategies. Okay, so we've discussed previously the high stress environment of the NICU. Families face a lot of challenges as they navigate the complexities of this infant's care, and it's critical care, right? They're in the NICU. So applying the trauma-informed care approach principles can profoundly impact the way that these families feel supported. So this approach not only enhances the overall care experience, but it also promotes resilience and healing during a really profound period of uncertainty and distress. So creating safe environment. So a trauma-informed approach in the NICU really begins with establishing a supportive environment, provides, prioritizes the emotional and psychological safeties of the family. So this includes, again, like creating a safe space that feels welcoming, it feels calming. It's in consideration of the noise level, the lighting, privacy, and as staff, we can kind of offer a sense of safety just by being more approachable with our body language, being more attentive, ensuring that families feel comfortable talking with us, and just providing that safe environment. It really alleviates the anxiety, and that lets people be more ready to hear what we have to say. Um, so also using clear communication and transparency, we've talked about this. Um, Clear and effective communication is really the cornerstone of trauma-informed care. So providers can try to convey the information in a really clear, compassionate manner. Again, avoiding medical jargon that can be confusing or overwhelming to families. Um, if you can, if you're one of the families who does follow-up care, providing follow-up care on the baby, and helping with treatment plan development with the families. That really helps them feel involved and informed. So it's, a lot of this is repetitive, but this is how we're applying what you guys kind of already do specifically to the situation in the NICU. We want to, again, involve parents in the care of decisions. So actively involving parents in care decisions reinforces their role as partners in the healthcare of their journey. So this can include discussing treatment plans if that's something that you guys are involved in, inviting them to participate in care routines, and just respecting their preferences. Parents are really empowered when they can contribute to the decision making and they gain a greater sense of control which again, like takes away a lot of that helpfulness. So like Jody had talked about, asking a family if they're interested in pumping. That family um, might be, especially if they're breastfeeding or want to breastfeed. A lot of babies in the NICU can't breastfeed. So if somebody has already marked down in the chart, yes, they're interested in breastfeeding, well, obviously they're probably interested in pumping, but just saying it in a question form makes it feel like the parents have the choice. Um, so again, providing the emotional resources and the support. So just acknowledging that this takes an emotional toll having a baby in the NICU. So again, like any counseling services that you guys can offer or support groups that your Light Touch program would offer if they enroll in, I'm sorry, I forget the name of the program after the Light Touch, not Heavy Touch, but sorry, Catherine or Faith, I don't know if one of you can tell me the name again of the program.
I guess we call it full.
Full
Welcome to
touch. Okay.
full
Yeah.
program versus the what light touch way.
Yes. Again, we talked about the cultural sensitivity. So implementing culturally sensitive care practices is also crucial in the trauma-informed approach. So we can just be aware of and respect diverse cultural backgrounds of families, understanding that cultural beliefs might influence the way that they perceive healthcare or their coping strategies. Just by integrating culturally sensitivity into our practices, we can build a better rapport with our families. And it just shows a sense of respect and relevance to the parents. So we talked about all these principles, just applying these to trauma-informed care in the NICU. We can create just a more compassionate, responsive, and healing environment for our families in one of the most challenging times in their lives. This whole holistic approach, it not only addresses like the medical needs of infants, but it also supports the emotional and the psychological well-being of their families, which, like we said before, it really leads to better outcomes for both the parents and the baby, because now the baby is getting not better care, but has more involved parents that want to put their baby on the right track, or just getting yourself as a parent like mentally on the right track to be able to provide for your family. Um, so we're going to go to the next slide. Perfect. Okay. So again, implementing trauma-informed care principles in the healthcare setting, it not only benefits patients and their families, but it also, for you guys, it significantly enhances the well-being for you, because it fosters a positive work environment where staff can feel empowered and supported, and it can alleviate some of the stressors that contribute to staff burnout. Because if you're constantly getting clients who are angry or irritable or don't want to have to hear what you say, um, as a provider, that's going to make me not enjoy my job. But if I can go into that and say, um, maybe this family isn't listening because they can't listen right now, and just being more sensitive, um, and more open about what your families might be going through, it can really change your own mentality and the way that you look at, how you're doing your job. Um, so staff members who actively engage in these supportive practices, you guys are more likely to feel valued and recognized for your contributions. And I know that a lot of times this is a thankless job, so I'm here to say thank you for what you guys are doing, because it really fosters a sense of a strong community in a workplace. Um, the support that you guys have for each other can also really help mitigate the emotional toll of working in these high stress environments like the NICU, where you guys are just constantly exposed to challenging situations. So we're going to go to the next slide. So again, I just want to thank you guys so much for joining my webinar today. I really want you to know, again, how important your work is. As a fellow NICU mom, I can honestly say that you guys are providing so much hope and comfort to families who often feel really overwhelmed and anxious. And so just being there for them, it makes a huge difference in such a tough time. So the kindness and the knowledge that you guys bring to your roles, it's really, really appreciated. And the impact that you guys have on families that you serve is so huge. So I just want to thank you again for the work that you guys do, and for contributing to my mission to fostering a more supportive community for families that are on this NICU journey.